Today, I'd like to share with you a little bit of self-care for the jaw. This can help your jaw hold less tension maybe, create more ease or more range of movement in your jaw. And sometimes working with the jaw helps indirectly also work with the pelvis. So if you're having any pelvic pain or low back pain, they are intimately related. And so sometimes working with the muscles and the musculature around the jaw can help also the movement and the balance of the pelvis. So we're going to work with an isometric with our jaw today in 3 different ranges of movement: up and down, side to side, and protraction and retraction, jutting the chin forward and then pulling it back. In these positions, we're going to use our isometric movement that is about 10 or less seconds long, and we're using the littlest amount of force, so it's 10% or less of your force. We're always going to start in the place of comfort, so whichever side or range of area your jaw goes easier, we're going to start there and push away from it or pull away from it in each of those positions. So first, let's start with kind of assessing how you feel in that up and down range, opening and closing your mouth a few times. This is also great to do in front of a mirror so that you can really see the direction that your jaw is going. Sometimes people think they're going straight, but really there's a little bit of veer to one side or the other. So check it out in front of a mirror. But let's start by opening and closing your mouth a few times. Moving slowly so your brain can track the direction that you're going. And notice where in that whole range do you feel like your jaw opens the easiest or is most comfortable. Maybe it's most comfortable closed, and then you're going to push to the open position. So somewhere in there, find the comfort, and then we're going to add a little resistance with our hands and then passively follow through after about 10 seconds. Here we go. And then after you've done the isometric, recheck and see if you notice a difference. Maybe you can really open wide now, I hope. Then let's try the left and right sides. So same thing, swing your jaw from left to right and notice which direction maybe glides the easiest or has the most range of motion or is just more comfortable. Keep it in that position and then push away. Passively follow through and then recheck. See if you have a little more swing in that jaw. And then the last direction is that protraction and retraction. So jutting the chin forward a bit and then pulling it right back. And see if you can feel where your preference is there. If you preferred the out, you can hold it out and try to pull it in. If you preferred the retraction or pulling the chin in, hold it in and push it out. Here we go, ready? And then playing with that movement again in the protraction and retraction, noticing if you felt a difference there. And then maybe bring your hands up to your jaw, your temporomandibular joint, and give it a little bit of love. What does it feel like it wants with that feedback of touch? Maybe a gentle massage or squeezing or even tapping or brushing. Just awakening that area a bit. And then maybe do a little more gentle gliding of your jaw, any which way it feels good. Just to integrate those new sensations that we just worked with. And then it might be fun to have a meal or talk to a friend and notice how your jaw is moving after those wonderful self-care explorations. I hope you enjoyed today. Thanks.